Well, first I'd like to thank everyone for coming tonight. I appreciate you taking the time out to listen to the presentation. I'd like to thank Elsie.
Could you speak a little bit louder?
Okay. I'd like to, I'd like to thank Elsie and Jean for inviting me to present to you today about what you need to know about your retirement income. As most of you probably know or can probably think about, when our parents retired, they basically just went down to the Social Security office, filed their form, got their benefit check, and didn't think much about it. But nowadays, the investment landscape, or excuse me, the retirement landscape, has really changed completely. It's now very complex and very confusing. Employers now have basically offloaded a number of the employers basically have offloaded a lot of the responsibility for your retirement planning basically onto you. So individuals now are responsible for making material, very critical decisions on your retirement without any real guidance. So what I would like to do today during this conversation with you, I'd like to talk to you and kind of present to you my journey going through Social Security and the Medicare process as well as retirement planning. I just turned 65, traumatic as that is. I'd like to share that with you as well. I've been an investment advisor for over 25 years, creating individual portfolios for high net worth individuals over in Asia, Europe, and in the US. And even with that background, going through figuring out which way to file for Medicare and for Social Security, I found one very confusing. It was complex, but also really alarming. I mean, the penalties of doing this wrong is something that will follow you for the rest of your life, and it will impact your retirement income for the rest of your life. So what I also noticed was that there were a lot of other people out there that made very bad decisions regarding Social Security because there is no guidance. You have a lot of advertisements on TV for insurance products. The government, not so much. They're not a very big marketer. It's there, but no one knows about it, and they don't tell you about it. You'll get your Medicare or Social Security book that's like 300 pages thick, and if you want to read it, good. It's helpful, but it's not something that will give you guidance. So what I would like to do is, first of all, again, thank you to Elsie and Jean for inviting me here today, but I always like to give back. So what I would like to do and offer all of you a complimentary review of your Social Security plan. And I'll do it complimentary for you, no obligation. It's a document that will go through and will help you decide what is the right claiming strategy for you. And as you see as I go through this process, it is confusing, and depending on your situation, everyone's situation is different, why it's important to make sure you have the right type of guidance. So there's a sign-up form over here. I think Jean has it. Please sign up. Happy to do it for you. So like most of you, I had a lot of questions regarding getting involved in Social Security. One, will Social Security be there for me? You hear all the press, Social Security is going bankrupt, there's no more money, all this other type of drama. I'll show you what that chart actually looks like. You can take it to the bank that, in fact, it is fully funded, at least for the next 10 years. And I'll show you how that is, so you can kind of rest easy with that. Number two, how much am I going to receive? That's a very personal decision for everybody. Everybody's benefit will be different. And I will show you, along with the other two bullet points, when is the right time that you should actually file for Social Security, because that is critical. It's one of the most important things that I would ask you to take away from this conversation tonight, is that when do you actually file is one of the most important things you can do for Social Security. On top of that, figuring out how to maximize your claiming strategy. I mean, you've earned this money. You've contributed to Social Security your entire life through your paycheck, through FICA. Spend it wisely. And the last question, will Social Security be enough to live on in retirement? Does anyone know the answer?
No.
Oh, okay. I was going to say one person gave them a prize, but I guess we don't have enough prizes. But you're right, you don't. So with Social Security, it is a pay-as-you-go system. So the individuals who are working today are actually paying in for the benefits for the beneficiaries today. With that, as an investment manager, what I like to look at Social Security is it's an annuity. It's inflation income you will get for the rest of your life. It's a huge asset, and I'll show you the values. I have a number of examples here just so you can actually see it, as opposed to me just talking about it. But looking at how you maximize your strategy, maximize the timing of your claiming could really benefit you really well over time. And also, as Social Security is an individual program or benefit, it's critical because it does also relate to your family, to your spouse, and to your surviving spouse if you are deceased prior. And I have presentations in here so you can see exactly how that works. In regard to the Social Security system, this is the chart. And what it shows you is that Social Security will last 100% fully funded until 2034. So another 10 years it's fully funded. After that, it's funded at 80%. Okay? So from there, and that's till 2094. The government is going to keep this fully funded. And for one really good reason, if we all just sit back and think about it. The demographic of individuals 55 and over are going to be one of the largest voting blocks in the country, basically in history. So the people who made this law is Congress. And who puts Congress in office? Us. So I think that if we have our voice saying, we want these benefits funded, they will be. And there's a number of solutions. It's not really difficult to do. The first one, increase the maximum earnings that are taxed on Social Security. Right now, through your earnings check, FICA, Federal Insurance Contribution Act, it's only the first $168,000 of earnings gets taxed for Social Security. Anything above that does not get taxed. They could just slide that up. The second piece is raise the retirement age. And they've been doing that basically since 1983. And I will show you here where that is. But they've been moving that age up from 62 now up to 66 and 67. And I'll give you an example of that as we go forward. Then, of course, they can always lower the benefits, like most insurance companies would do, or change the COLA, which is the inflation target that is also on this program. So we'll just skip this one. So what does this look like in terms of a check? Because this is what's really important. How much money are you going to get every single month? As I mentioned, it's inflation protected. So the $2,000 is what would be your earnings from Social Security. It's called the PIA number, the primary insurance amount. That's a very critical number. It's a critical definition, and you'll see that many times through this process. So if right now you are getting a check for $2,000 from the government for Social Security, in 10 years with inflation, because they add a 2% COLA on top of that, which is the rate of inflation on average, your check would be, if you live 10 years, $2,400. In 20 years, your monthly check would be $2,900. Now, to look at that in terms of lifetime income, that check, or that $2,000 turns into $262,000 if you live 10 years. If you live 20 years, it's $583,000. So as an investment manager, you can see why I consider this an asset class. This is something that you need to manage and be part of your overall full retirement program. Now, how do you actually find out how much you get for your individual benefit? There's two main criteria. The first criteria is put out by the Social Security Administration. What they do is they look at your overall earnings history. How long have you worked? They will take the highest 35 years of earnings, and then they have a factor onto it. They rate it for inflation. I have a chart here that's in your packet that you can see what part of that calculation is. We won't go into it now. They average that all together, and that's how they come up with what we call the PIA number, the primary insurance amount. And that you need to know that number. That's critical to you getting your proper benefit. The second is, what is your claiming strategy? What age do you actually claim Social Security? Because that is another key determinant on how much money you get every month for the rest of your life. This is the formula, pretty scary. And here. So, in trying to determine when to apply for Social Security, the claiming strategy, 5 key criterias. The first one is your health status. Are you healthy? Do you have a terminal illness? Are you going for a major surgery? Or are you really healthy? It makes a difference. You can postpone your getting your benefits, or maybe you might need to move them up for a number of reasons. Second is life expectancy. What is your family history? Is it long-term, short-term? You don't know. And then the third is also very important, the need for income. Some individuals will have plenty of assets where they don't have to claim Social Security right now. You don't have to take it. Other people, they need every dollar and they need it now. Next, whether or not you plan to work. You can work and collect Social Security at the same time. There's rules and conditions that do impact that, but you can do both. But again, that affects the amount of money you get or the money that you don't get from Social Security. And last is survivor needs, and there's a special chart on that a little later on. So with this here, and this is where we're going to start getting into the claiming strategies for you. The reason why you don't collect at 62, you can claim as early as 62 up until the age of 70 is when you can delay it. The main reason why you don't is because the government will penalize you for taking the money early. This number here, the full retirement age, is the base number. You need to know this number, and this is really what your age is. What is your birthday? Because every dollar you get from Medicare, from Social Security, is based off of this number. So what Congress has done in order to make the Social Security program last longer is they, in 1983, had an amendment to the rules that started adding on the age of retirement, 2 months a year, from the birth year of 1954 forward. So every year, as you can see, 2 months are added on to the dates. Mine is 1958, so my retirement date is age 66 in 8 months, and it goes up to the age of 67. So why is that important? And this is basically the crux of the conversation. If for example, your full retirement age is 67, but you claim at 62, the government is going to penalize your earnings by 30%. Okay, they don't want you to collect early, so they penalize you 30%. Now, the closer you get to your full retirement age, that penalty gets less and less, so they don't hit you as hard with the stick. But still, they don't want you to do it. Now, on the other side of the coin, what happens after full retirement age? Well, same situation. If your PIA is at 67, you can see at 67, you get 100% of your benefit. So the government's happy. But what they also do is if you wait until the age of 70, the government gives you 8% a year on your money for every year that you wait. That's a pretty good investment. And all you have to do is wait, if you can. And so every year, as you can see, it goes up 8%, at age 67, from 108 up to 124. So you're getting 124% of your allotted benefit of your age at age 67. And so what does that look like? Percentages are nice, but I like to show the dollars. Here, if your PIA is $3,000, so your government check is $3,000. That's before Medicare and taxes take their chunk. If you claimed at 62, you're going to get a check for $2,100 every month, and that includes the inflation factor, which is called the COLA. Now, if you waited until your full retirement age is 67, you're getting $3,300. So you're getting $1,000 more. If you wait till the age of 70, you're getting $4,300 a month, $2,000 more a month for waiting, just for waiting. That's all you have to do. Now, what that looks like when you're delaying benefits after the age of 70, okay? If you live 10 additional years, if you claimed at 62, your check is $3,000. Whereas if you claimed at age 70, it's $5,300. And so you can see the difference between claiming early and waiting and defer that claim a little bit later. And you get that check every single month for that amount. And every year it goes up. After the age of 70, there's no more 8% increase. So between your full retirement age, 66 or 67, up to the age of 70, you will get that 8% every single year. So how do you figure out your PIA number? Contact Social Security. This is their website, www.socialsecurity.gov. I called them because I had tons of questions. I found them to be incredibly knowledgeable. I mean, these people know their stuff. And for a government agency, or for any agency, they are incredibly friendly. I mean, they will help you to the ends of the earth on how to fill out your forms, where to get your information. I thought they were just wonderful. So, now, what happens if, and we're going to get into the claiming strategies now. What happens if you're an individual that has a terminal illness, or you know you're not going to live a long time? Should you just take the checks now and get as many checks as you can and then basically go home? Not really, no. It depends. And the reason for that is because if you're a married person and you have a spouse, what happens is that if they are the higher wage earner, their benefit when they pass away goes on to their spouse. So if they claimed early and they get a reduced benefit, the surviving spouse gets less money. If they wait, that spouse gets a higher benefit over time. So, and that's why I said this is a very personal decision. Everyone's situation is different. So, in terms of the benefits or claiming strategies for everybody else, if you're a married couple, one of the strategies to maximize your Social Security benefits for your household, you have a high wage earner, in this case it's John. He makes $2,000 or he has a $2,000 check from Social Security. His wife gets $800. Now if she applies for her benefit at her full retirement age, okay, she gets $800. But since she does it at her full retirement age and not early, she gets 50% of his benefit. It doesn't take away from his benefit. She gets $200 more every month. So Social Security will pay her her benefit. She will file a separate spousal claim, and she'll get an additional $200 on top of that every month. There's also strategies for individuals who are widowed or divorced, and I'll go over just some of the data points here. It's a very complex way to do it, to get benefits to someone who is a survivor and even to a divorced individual, but they're there and they're available to you as long as you meet certain requirements. For a survivor, there's three main criteria. The first, what is the age that the deceased person actually claimed their benefits? Did they do it at full retirement age, or did they claim early? Was the couple married for at least 9 months? And three, the age at which the survivor claims. If the survivor claims before their full retirement age, their benefits get reduced. If it's full retirement age or after, they get a higher benefit. So this is an example. Again, Joe and Julie. Joe's PIA is $2,800. He waited until he was 70 to claim, so he got the 8% what's called delayed credits. So his benefit is really $3,472. Joe passes away. The surviving spouse gets the higher benefit. She doesn't get the $2,800, which is the original PIA. She gets the full maximum benefit, including the 8% delayed credits for every year up until the age 70. So she gets a higher benefit when he passes away. It's another way to maximize your income for your household from Social Security. And then with a divorced individual, the same criteria applies, except for the fact that you have to be married for at least 10 years. The ex-spouse is at least 62 years old, and also there can be multiple ex-spouses, and it wouldn't affect anyone's individual benefit. So if someone has been married for 10 years, 2 or 3 times, each and every one of those individual ex-spouses could be entitled to the same benefit. So to take away from the Social Security component, number one is remember that Social Security is an asset class. It's an inflation-protected income for your entire life. You really can't lose it unless you commit fraud, and even then I'm not sure they would take it away. The next is be careful when you claim, because when you claim early, you're reducing your benefits, unless you actually have to. Next, there are programs for individuals and couples, as well as widow and divorced individuals. It's a little bit more complicated, but it's available to you. And so that's why, I offer, everyone, sign up for this complimentary review. You can see all the different situations there. That's only just a few. I don't have enough time to go through all of them, but I think it's something that could benefit you. Following that is we'll go into Medicare. With Medicare, as with most government programs, as I mentioned, One thing the government likes to do is they like to penalize you if you don't do what they say. Medicare is no different. One of the key things you need to remember when you leave this seminar tonight about Medicare is please enroll on time. There's very specific reasons why. I'll go into the details of that and what the repercussions would be to you if you don't do that. Next is that most people aren't aware of this, but Medicare is not a full pay system. It is an unlimited payment system for the individual. Medicare pays a certain amount. Anything over that, you are responsible for. So it's not a full pay, so it's very important that you have a supplemental insurance policy or a plan that matches what your goals and objectives are for your health care needs. With Medicare, two things. One is that it's administered through what's called the Center for Medicare and Medicaid through Social Security. So when you get into the government, there's a number of different agencies that all work underneath each other, and that's one of them. Most people believe that Medicare is just one big platform, and it's really not. It's four, and I broke them out here so you can see them. Because when I went through my journey, as I like to call it, I had no idea. It was like, Medicare, yeah, I just file my form and, A and B and whatever, and I'm good to go. No, not at all. So with Part A is your inpatient hospital coverage. Part B is outpatient hospital coverage, such as doctor visits, diagnostics, lab tests, x-rays, things like that. Medicare C is the Medicare Advantage plans. So all the advertisements you see on TV, Humana, Blue Shield, Aetna, that's them. And then Part D is your Medicare prescription drug coverage, which is separate from Medicare Part A and B. Now, how do you actually get Medicare? There are two plans. Most people think there's only one, the one on the left, Medicare Advantage, because that's what you see on TV. You see all the advertising for all these happy people running in the fields, and healthcare is wonderful. What Medicare Advantage does, it is a program that's basically an HMO. It's an in-network program that covers Medicare Part A, Part B, Part D. It also covers vision, dental, and hearing, and the prescription drugs, as I mentioned. Whereas Medicare Medigap plan, which is the plan on the right, is the government program. Government doesn't advertise, so people aren't aware that it's there for them. What's known as original Medicare is Medicare A and Medicare B together. They're combined. When you sign up for the Medicare Medigap plan, you would sign up for a number of different policies. You have Medicare Part A and Part B, a separate policy for Medicare Part D, which is your drugs or prescriptions. Then you need a separate policy for your hearing, vision, and dental. And then the Medigap, which is really the most important. That's your supplemental plan. That will cover everything that Medicare Part A and Medicare Part B does not cover. I have some slides in here that will show you how those plans actually work. They're pretty complicated, but when you're enrolling in Medicare, and I'm going to go through some of these slides for you, what the periods are. If you are already collecting Social Security, you're automatically enrolled in Medicare Part A and Medicare Part B. It's automatic. You don't have to think about it. There's no penalties. There's no other requirements. However, it gets a little bit tricky when you're not already on Medicare. You're subject to 3 individual enrollment periods. The initial enrollment period, special, and the general. And it's very critical that you get the right enrollment period for a number of reasons. For the initial enrollment period, and the government defines what qualifies you to apply. If you are working with a group that has 20 or more individuals with a credible health insurance plan, is not covered by a group plan, then you have to apply for the initial enrollment period. You have 8 months to do that from your birthday, 3 months before your birthday month and 3 months after. And the reason why it's very critical you do that is because if you have a pre-existing condition or you have a health issue, or you have a major surgery coming up, when you're in that initial enrollment period and you apply for Social Security, they cannot refuse you. They have to take you. If you miss that period and you try and get insurance after that, they can deny you coverage. Or they're going to charge you a lot of money because you have to go through underwriting to get your insurance coverage. That's why this is so critical. Next, it's a special enrollment period. And this is where, if you are working with a group that has 20 or more individuals with a credible plan, you do not have to apply for Medicare. You get a waiting period until after you cease employment and you cease participating in that plan. Then you have a special 8-month period to enroll in Medicare Part B, but only 63 days to enroll in Medicare Part D prescription drugs. And if you miss any one of these enrollment periods, you are penalized on your premium by 10% for every year that you miss that for the rest of your life. You don't ever get to make that up. It never goes away. So and that's why I found it so alarming, because premiums go up every year, which means every year you get older, your premiums get harder and harder. And the last is the general enrollment period. So for folks who did not show up at a seminar and aren't aware of the enrollment periods, then this is the time that they would do it, and that's January to March. However, if you do it then, and you were supposed to enroll in either initial or special, you will get a penalty from the government. So just to be clear, for Medicare Part B, the individuals who are required to file for Social Security at age 65 is that if you're not working, if you're self-employed, or if the company you're working for has less than 20 employees, and also if you're on a COBRA plan or a retirement plan, you do not qualify for the Medicare exemption, so you have to apply for those benefits. Now, Part D is the same. And what I did here was for the special enrollment, because there are two different time frames, I put this on a chart just for your records. It's in your package. And then this is the full notes for you, so you can take all three of these individual enrollment periods side by side, so you can see this is for you. It's in your packet as well. We've gone over it, but I wanted you to have it together because it gets confusing when you're looking separately. So how do you sign up for Medicare Part A and B? And again, this is different. With Medicare, you sign up for A and B, Social Security, www.ssa.gov. But for Medicare Part D, oh, here we go. For Part D, you have to sign up through Medicare.gov, as well as if you go for a Medicare Advantage plan, you also have to sign up through Medicare.gov. So as I mentioned, it's not just one platform, it's different. And they have different websites for you to get into, sign up. Now, once you get online, it's fairly easy. I mean, you could probably do it in 10, 20 minutes going through the form. I love technology, it doesn't love me back, and I was able to do it. So I think you should be okay. If not, you can call them at their numbers, and they're really very, very helpful. So getting into all of this, there's always a cost to everything, right? It has to be paid for. So who actually pays for Medicare? Well, for your health care in general. Before you're 65, as we all know, most of us don't really think a lot about it. Our employer pays, COBRA pays, individual health insurance pays. However, after 65, Medicare pays. And one thing that's also very critical is that if you miss your enrollment period, you also don't have insurance, even if you have a secondary insurer. And the reason for that is what I have up here on the chart. Medicare pays first. If you're supposed to pay for Medicare first, if you have a health insurance issue and you don't have Medicare and you're supposed to sign up for it, but you have a secondary insurer, the secondary insurer is going to look to see if Medicare paid. If Medicare didn't pay because you didn't sign up, they may not pay, which means you pay. So there's a lot of liability here, which is why I found it so alarming. There is no grace periods here, or I'm sorry, you pay. So in terms of monthly premiums, I'll go to the next one, it's easier. This is the chart that I wanted to get to. So with Medicare Part B, all of us are equal. We all have the same base premium, which is a 174.70 on the, I guess, the fourth column down. We all pay that regardless of our income. However, if you are what is defined as a high wage earner by Medicare, as defined by one of these income classes, well, you're going to get a surcharge. You're going to pay extra for your Medicare, Part B. So you would take the 174 plus, let's do the 161,000. If you made $161,000, then your base premium for B is 174.70 plus 279.50 on top of that. Now for Medicare Part D, since it's basically free, you also get a surcharge of $53.90 because you exceeded the income levels and are defined as a high wage earner, for a total of $508 just for Medicare Part B and D. That doesn't include your secondary insurer or your insurance for vision and dental. And also what this surcharge is known as IRMA, which is the income-related adjustment amount. Now, what's tricky about that is that wage, or those earnings, those aren't for this year, and they weren't for last year. It's 2 years prior. So the income you have this year in 2024 will be the income that will be your base for your premiums in 2026. So what does Medicare cover? There's a whole book on what they cover, but just to highlight it, your hospital stays 100% of the first 60 days, basic medical services, as I have here, and then some preventive services. The next slide basically shows what it doesn't cover, and it doesn't cover long-term care. A lot of people think it does. It doesn't, which is why you need that supplemental insurance and also long-term care insurance that we'll get into a little bit later on. Additionally, it doesn't cover the amounts above what the Medicaid or Medicare approved amounts are. Your supplemental insurance will cover that. Now, the actual Medigap plans. The Medigap plans, remember we have Medigap and we have the Medicare Advantage plan. So you have two basic options to get Medicare. They are run by the government, and on the right-hand side, you will see all the benefits for that plan. That is standardized by the government. So the only thing that's different between the different insurance companies under a Medigap plan is the price. That's it. They have the exact same benefits. The recommended benefit now is what's known as Plan G. They're all given off by individual letters, A through N. Used to be F was the one, but now F is no longer available. So if you're retiring now, you go with Plan G. I have Plan G. That is obviously the most comprehensive. So that's the one that individuals choose. When you go to, I missed one, I'm sorry. So when you go to Medicare Advantage plans, those are in-network plans. It's an HMO, so you can only go to the doctors that participate in those individual plans. Whereas the Medigap or original Medicare plans are any doctor in the country, and even internationally, that accept Medicare. Most doctors do. So you have more freedom to go around. In case you get sick, let's say you go to Iowa or Florida or wherever, you're covered under the original Medicare plan, whereas a Medicare Advantage plan, you may not be. The next reason why you need supplemental insurance is because I think we all know the additional costs of health care. They're going to continue to increase. I don't think I've ever known a time when healthcare expenses have actually gone down. This chart here basically just shows it, by gender. It's a little bit dated, but you can see with the men and with the women, $9,000, $10,000 basically a year in healthcare costs. I did put in here what a rough budget would be for expenditures, but that's basically an average cost. So in regard to Medicare, again, the most important thing you should take away from the conversation we had tonight about Medicare is your enrollment period. If you can get your enrollment period, you're basically 85% there. You're basically protected. As well as matching what insurance works best for you. Is it the Medicare Advantage plans, or is it the original Medicare plans with plans A and B. Now, with rising healthcare costs, obviously long-term care is a major factor nowadays. The way that people are trying to take care of that cost is through long-term care insurance. But again, with long-term care insurance, it's really an unknown. It's probably one of the hardest products or insurance products you could possibly buy, because you're trying to project into the future an unknown about an unknown. You don't know what your health is going to be. You don't know what type of care you're going to need, what level of care you're going to need. Are you going to age in home? Do you have to go to a care facility? Is it going to be serious? Is it going to be light? Do you have people available to help you? It's a really tough decision to make. Long-term care insurance can, of course, protect your assets in case something does happen. And like most insurances, we all hope we never have to use them, because they do have to be paid for. As you can see, I did put here, just for your information, when you're buying healthcare insurance for long-term care, you will have different levels of insurance. In-home care, custodial care, and skilled nursing care. And as you can imagine, the higher the level, the more expensive the insurance. And the older you are, the more expensive the insurance and less benefits you will most likely get. So in regard to where does everyone have or the majority of people have their retirement income? In the United States, it's basically in your 401k plan. If you're a teacher or government employee, 403B plan, or an IRA or a Roth IRA. What I just put in your notes basically is just the increases that the government put in for 2024 for the 401k plan. Your salary deferral now has been increased to $23,000, and if you're over 50 years old, you get the catch-up, which is up to $30,500 or $7,500. Now the next is traditional basic IRA. With this, just a couple of bullet points. The first is that your savings grow tax deferred while it's within the account. But what a lot of people don't recognize or realize is that those withdrawals, when you pull them out, go directly to your income. So you're paying original ordinary income tax on that income. With traditional Medicare, as with the Roth IRAs, the government did increase the amount that you can set aside for both. It's $7,000 a year, $8,000 if you're 50 years or older. Now, I put this up here in terms of the types of compensation. It has to be earned income, basically W-2 wages. So if you have passive income or investment income, it doesn't qualify for the IRA. You have it in your slides. The next is about the Roth IRAs. With a Roth IRA, the same minimums are there. Okay, the same minimums are there. However, two distinct factors between a Roth and a regular IRA. With an IRA, what happens is when you turn 73 or 75, the government mandates you to take what's known as RMD, required minimum distribution. So you've saved your entire life with your IRA thinking that when you retire, you'll be in a lower tax bracket. However, if you've been really successful in your IRA and it has a high value on it, the government will tell you how much you have to take out every year based on the amount of the value of your portfolio on December 31st of the year prior. So every year could be different. If one year we have a robust market, your RMD will be very high. And the reason why that's a problem, it's a lot of problem for my clients, is that can kick you up into a higher tax bracket because it's counted as ordinary income. Okay, here. So it will kick you up to a higher tax bracket. If you go up to a higher, no, it's okay. I got it. It's okay. It's okay. The world's giving me a message to shut up. So what it does is it kicks you up into a higher tax bracket, but that could also mean that you're now disqualified for certain contributions, deductions, and exemptions on your tax when you're filing for your taxes. One way around that is with a Roth IRA. With a Roth IRA, what you do is when you get into a Roth, you're paying the taxes before it goes into the investment account. So it grows tax deferred basically forever. You can take that money out anytime you want or not. And it could also go right into your estate if you wanted to. It's a great way to fund an inheritance. And the reason for that is the fact that you're paying your taxes up front, whereas with a regular IRA, you're getting taxed from pre-tax dollars afterwards. The government is always going to get their money. The last thing I'll say, in summary, is that with all the different income sources that you have, need to be put in aggregate, together. What is your savings account, your IRAs, any type of earnings you have, any type of investments you have, all into one package to figure out what is the best way to fund your retirement plan so you have a successful retirement. So with that, I'd like to thank you for your time and for listening. And I think we have time for questions. Yeah. Okay. So thank you. If in fact you're married and your spouse passes away, but before the age of 62, how does the surviving spouse claim benefits? The only way you can really do it is you have to wait until the age of 62 to claim. Yeah. If you claim prior, you really can't do it. Elsie's asking if long-term care insurance is required. It's not required. A lot of people think that it is. I mean, you hear stories about that, but it is not required. Depending on your situation, it's strongly advised. You know, if someone has healthcare issues or your family has low life expectancy, it's probably advisable. It's not for everybody. It is very expensive, but no, it's not required. Her question was that there is a long-term bill pending, and she wanted to know about that. My understanding is that yes, it may pass, but not really sure. I'm not really sure if it should. You know, you're right that it is under discussions, but right now there is not a law that requires you to have long-term care insurance. There's no law on that. But it is under discussion. You are right about that. The statement was that a lot of people can't afford long-term care insurance, and that's exactly right. I mean, you know, you can go to some of these policies, and they are very expensive. You know, and the coverage, the older you get, as you know, the more expensive they get, and the amount of benefits you receive go down drastically or dramatically. So for the government to actually require you to have long-term care insurance, unless they make it a federal program where people actually contribute to that, I don't see how they're going to be able to do that. That's just my opinion. Okay. The question is, when do the three enrollment periods basically come into effect? Is it age 65 or another age? They all kick in at age 65. So the initial enrollment period is the most critical one. That's the one where most people fall into, where they don't work for an employer with greater than 20 people with that type of coverage. So if you miss that one, that's the one where if you miss it, then if you have a pre-existing condition, then you're not going to get coverage. Or if you do get coverage from an insurer, it's going to be a lot higher. But you're right. It's age 65 is when that gets triggered. The question was, when you turn 65, does anyone tell you that you have to file for Social Security or for Medicare? The answer is no. You basically have to figure it out for yourself, which is one reason why I got involved with this myself, was because I thought that was so incredibly unfair. Because if you think about it, you work your whole life, and then you come to 65, you think you're doing good things, you decide, well, I'm going to work longer because I can, I'm healthy. In the meantime, you miss a federal timeline, enrollment period, and then for the rest of your retirement, you're paid a penalty. You have to pay a penalty. That's not fair. So, with that, no one tells you that. You're basically supposed to just know it. There is no real advertising. The government does not advertise it. Unless you go into like AARP or something like that. Those types of sources would certainly tell you, but the government does not tell you. The lifetime penalty, yeah, and as you, every year since your premiums go up, your penalty goes up because it's 10% of your penalty for every 12 months. The statement is that she works for an employer that has told her that she can fill out forms that she's employed, so that she won't have to file for Medicare. That's correct. And that's where the special enrollment period comes in. So you can stay as an employee without filing for Medicare for as long as you're an employee and for as long as you have covered, or what they call credible coverage. Once that ends, you have 8 months to get coverage. But remember, in that 8 months, you have no coverage. So it's always recommended that before you leave your employer, you sign up for insurance. There's no disadvantage. Oh, excuse me. He asks, is there a disadvantage to working and then applying for Medicare? There's no disadvantage to that. As a matter of fact, if you can do it, you might want to, because sometimes the Medicare coverage, Part B, could be better than your employer's coverage. So yeah, if you can do that at 65, you certainly can do that. There is no penalty for that. The question is, she heard from my statement was that Medicare is funded until 2034 at 100% coverage. After 2034 to 2094, it's covered at 80% value of benefits. Okay, so the concept is, and what I had stated was that, as individuals over 55 will be the largest, if not, will be the largest voting bloc in the U.S. Congress is the one that sets those limits. We as voters will obviously talk about that. We want them to have it covered. So we believe that they will, of course, fund it. There's a number of strategies to do that. One of them they're doing already. They did it in 1983, where they're moving up the retirement age to extend the life of the program. Okay, so that's where the full retirement age slide comes in. Okay, so every month after 1954 birth date, the retirement age is upped by 2 months, up until the age of 1960. Okay, and then from there, it's age 67 is the retirement age. So if they want to make it last longer, they could extend it up to 68 or 69 if they wanted to. Yeah. What she stated was on her Social Security statement, there's a line that says that her benefit will be reduced by 20 or 30%. And that goes up against the claiming strategy I talked about. So if she claims at age 62, her benefit will be reduced by 30%. So if you have, like on the slides, the $3,000, if you get as your primary insurance amount, and that's the amount that the government says is your benefit, and that's before taxes and before Medicare, because Medicare is deducted, straight from your Social Security check. They're not going to wait to get their money; they're just going to take it from you. That's where that comes from. The question was, for individuals who can't afford long-term care insurance, which is obviously very expensive, what are some ideas or some concepts you could use to kind of, address that issue? There's a couple. There's not very many. One of them is we put individuals into a bond portfolio, a fixed income portfolio, so you always have money coming in. Number two is you rely heavily on your Social Security, because when you have Social Security, you never run out of money. You're always going to be getting a paycheck for the rest of your life. For your rest of your life, you can move anywhere you want. You're going to get your Social Security check. So that's factored in. But what we do is we try and put your assets around and more as a fixed income vehicle as opposed to an equity portfolio, because there's too much risk with that. And that's the best really you can do. There are some government programs that people can get involved in. You could obviously spend your money down and get on Medicaid if it comes to that. So you could get coverage. It's not, nobody really wants to do that, of course. But what we do is we build basically fixed income portfolios around those costs. We try and meet it. We're usually short, but that's the best way we know how to do it. The question was, what are the ranges for long-term care insurance? That's a tough one, because it's really all over the board. I really don't even have a number for you. I do have some clients that pay about $12,000 a year for that policy. They're very sick. And there's others that obviously would pay a lot less. It's hard to say because they are so individualized. I'd like to give you a better answer, but I don't have one. The question was, is there a minimum or a maximum to the amount you get for Social Security? And the answer is really no. The payment amount for each individual is based on your earnings history. So what the government does, it looks at your highest 35 years of earnings, and it does all the factoring to come up with a number. Now, what happens if of those 35 years, you stayed home for 15 years to raise kids, right? You don't have 35 years of earnings history. You worked, but you don't have earnings. So what the government does is they just put zeros there. So your benefit is even lower. Whereas if you're a high wage earner, it will be capped at the income level, but that's the range. I mean, there is no real dollar amount that way, because every year it adjusts due to inflation. Well, yeah, there is a cap because it's not a dollar for dollar, but it changes every year. There is no consistent. No, it's about 4,000. The question is that with life insurance policies offer a long-term care, is basically a long-term care rider. So what happens there is that the typical policy will say if you have a life insurance policy and you have it's basically a terminal illness, which means you're going to pass away within 6 to 8 months, you can draw down on your benefit, your lifetime benefit, to pay for those services. That's what that is. No, but the question is, or the statement is, would that be more expensive or less than long-term care? It would be less because you're buying it through the life insurance policy as a rider. It's not a specific policy for long-term care. So, and it's very specific that it has to be a terminal illness in most cases in order for you to draw out of your life insurance policy to pay for that. The question is if you have different conditions, would that be covered? That really depends on your life insurance policy. You can get riders for that. You can, and obviously you pay more for that, but it could be a rider with a life insurance policy, and those costs could be all over the board. The statement or the question is, how do you know if it's a good option to convert from a traditional IRA into a Roth? It really depends on, one, your age, and two, your income level. Because like you rightly mentioned, for the conversion process, and there is a slide in your packet on it, it's just a high-level piece, is that the income, or excuse me, the taxes you pay on converting over, could be higher than the benefit you would derive from, having those assets grow tax-free. So you have to go back and look at what your income level is, how much you're going to pay on taxes, and what age you're going to do it at, because it may not make sense. It's definitely not right for everybody, because it can be very expensive, because that conversion goes right into your ordinary income, so it increases your taxes. So, and if you're already on Medicare, that hits your Medicare Part B as well, and Part D, so your premiums would go up as well. So there's a lot of individual factors that go into that decision. The question is that on one of my slides, for one of my examples, I showed a high wage earner and a lower wage earner, and the assets that they take is at 50%. You're right. There was a rule back then that they closed off. However, for just say an average spouse, if I could say it that way, husband and wife, if you have a high wage earner, the way it works is that if both individuals file after the full retirement age, then the spouse can take, instead of taking his or her own benefit, which in this case would be less, let's say the $1,000, okay, there it's $800, then there's two filings. One is it could be her individual filing where she gets the $800, or she can have a separate filing or a separate claim and get the additional $200 on top of that. So it's 50% of the higher wage earner's claim, or PIA number, excuse me, PIA. So that is a constant. A lot of people don't know that, so that they think that if you're married and you're a lower wage earner, you file it for retirement, you're stuck with that lower earning. You're not. You're not. You can file a spousal claim and get the additional benefit up to 50% of that individual's claim. Now, if they make more than the 50%, it doesn't make any sense. Okay?
Thank you.
Okay. All right. Thank you very much.